yes, those 78 cases reported this morning, of course, over the course of the few days. And we just also do want to point out to our viewers listening in, the Commonwealth Healthcare Corporation is catching up on that data. So you do notice the latest releases that those are from prior days, and we're waiting for the latest numbers in the most recent days. We do also want to provide the latest with regards to the federal teams that are here. The Commonwealth Healthcare Corporation telling us that the teams are here. They have the HHS Regional Emergency Coordinator on the island assessing and providing federal support. They also have the CDC support that will be that has arrived, and that will help the response with regards to epidemiology and data analysis. And also a team from the Disaster Medical Assistance, about 10 of them, to assist the Commonwealth Healthcare Corporation with the monoclonal antibody treatment and the mission of vaccination. So we're going to try and check in with those federal teams as they settle in on island and address the COVID surge that is happening here. And since October 28th, since the first community case was identified in the over 200 days of no transmission prior to that, there have been 891 cases. 444 of them were identified via contact tracing, 435 via community testing, and 12 via travel testing. And I just wanted to switch gears as the JGO committee in the CNMI that is investigating Governor Torres made a recent announcement. They tell us that the testimonies of both the governor and the Department of Public Safety Commissioner Robert Guerrero in the House investigation into his expenditures, they're both expected to testify Friday at 10:30 in the morning at the legislature. Changes were, of course, made as the governor released new COVID-19 restrictions over the weekend. The legislature has decided to remain open and will prepare to put in COVID-19 precautions. Selena Babauta, who's the chair of the JGO committee, told us that quote, the burden to reconcile the need to be vigilant in light of the recent surges in COVID-19 cases with the need to continue our legislative mission weighed heavily on the decision. She also adds that because of these COVID-19 restrictions, seating in the House chamber may be restricted to ensure social distancing. And of course, that will also be streaming. It is important to note that the CNMI office of the governor has yet to confirm if Governor Torres will appear before the committee on Friday being christened. So that's some of the latest news here on the CNMI.
I did want to ask Tomas about, because you're right, there seems to be a delay in the reporting of confirmed cases. Have they provided any reason why?
That's why the team is here. Part of the team from the CDC and I believe FEMA also is being brought in specifically to do the epidemiology, the data analysis, things like that. As you recall, the regional epidemiologist, Stephanie Curran-Alali, was only here for about a week or a few days. She had to return back, I believe, to Guam or wherever her work will bring her with the Pacific Islander Health Association, I believe. And so, yes, and they're quite busy, and with the support now on island, they'll be able to catch up on some of those data. And in addition, we're planning to speak with some of the teams about some of the training and work that they're doing specifically with the monoclonal antibody treatments here in the CNMI as well.
I guess what I'm asking is, in terms of why is it difficult to say, whether or not there were X amount of new positive cases the day after the test
I think
results?
they're crunching the numbers. They're still crunching the numbers. My understanding is that there's probably about, one or two people working on that at the moment.
Wow.
And you can imagine with the surge that it can be difficult to catch up. And so what we heard is that they're getting more help to do that very, very detailed legwork. So the help is here, and we're expected to hear more about that. We're going to try and get some of the teams to speak with us as well.
And so now that the federal teams are there, does that mean there were five COVID-related fatalities there in the CNMI, are we going to get information in terms of how old they were, whether they were vaccinated? I don't think I saw that in any of the CHCs.
That has yet to be seen. As you also probably noticed, Bree, the vaccination status of those cases always say pending, and so I'm sure that that will be part of the data work and something that we'll follow up in detail as well as the cases surge here. And I think we'll more information on what they're working on. I know that one of the big things that they're also working on is training healthcare workers on Rota and Tinea on how to administer the MAB treatment. And so and we're expected to hear about how that's going as well once we catch up with them.
What about the hospitalizations? It looks pretty, 8 now hospitalizations over there?
Yeah, 8 yeah.
Is the alternate care facility open now? Or has
Yes,
has
the
been
alternate
open?
care site has been open. It's unclear where exactly these 8 individuals are hospitalized. We haven't had a media briefing since the last time we spoke. So, and of course, since then, we've unfortunately had the 2 deaths that we reported on. And so they did say in that report, though, that none of them are on a ventilator. But we do know that they're administering the treatment as they do come in. And we know that at the hospital, they have the capacity, at least last we checked, for about 4 patients there who might be receiving a heightened level of care. And then at the alternate care site, they have the capacity for 30 beds.
All right. Well, thank you so much, Tomas.
Thank you.
All right. Be safe out there. The Biden administration is implementing new travel rules to help combat the spread of the Omicron